D. Bharat Kids learning session. We are continuing with the social skill development series, and under social skill development series we have been discussing the third problem behavior, which deals with antisocial behavior or aggressiveness of the child and various aspects of this over last few sessions. And under this, today we'll be talking about the second component or second aspects of antisocial behavior or aggressiveness, which is about the physical aggressiveness of the child. This is a very tricky subject. Sometimes the toddlers or children between 3 and 4 years of age, when they are unable to speak and express properly, then most of the times they try to express their emotions through physical behavior. So because of that, such kind of behavior sounds, or it may look like as a frequent behavior. So we as parents or teachers need to be very, very careful to come to a conclusion if a child's behavior is aggressive from the negative perspective or not. So we'll be discussing various aspects about that, and that will help us to manage our child in a more effective and in a more positive way to ensure that child is not having that physical aggressiveness in the behavioral pattern. So as usual, it's very important for us to identify when a child is physically aggressive. As I said, sometimes the child is unable to express. That's where the child is bound to express the behavior through physical behavior. That means showing something which is physical, and child is able to do that because child is not very vocal at that point of time. Because of that, child tries to do something through physical activities. But we need to understand when we have to be careful, where we need to give more attention. It could be a symptoms or it could be the pre-symptoms which may lead to such kind of physical aggressiveness in future. So considering this situation, we have to take care of few situations where we parents and teachers need to be little careful for this purpose. Then first, symptoms or signs we need to be very observant. That is, child kicks objects or peers very often. See, as a part of motor skill development, we sometimes ask the child to kick some stationary items like soft balls. And when that is being asked, then the child follows that instruction. So in that case, it is absolutely not a sign of physical aggressiveness. But if no instruction is given and child knows very well that a particular thing is not part of some kind of school or house activities, but the child is kicking a ball or kicking some other children out of frustration, if that happens, and that happens very frequently, then that is a sign of concern for the parents and teachers to know that the child is becoming very, very aggressive physically. That is one aspect we must keep it in mind. Second aspect, which is a kind of trigger to the future situation of aggressiveness, if a child is struggling academically, and this is a common cause for any child becoming physical aggressive, because what happens when a child is not able to perform as per the expectation, then there is a frustration. and that frustration will lead to physical aggressiveness. So we have to be very, very clear that whether a child is struggling as far as various studies is concerned, because most of the children, they are not quite disturbing, or they are not struggling as far as the various activities are concerned. They may remain silent, or they may try to not participate in a particular activity, but as far as the struggling is concerned, that is only linked to academic expectations. So in the preschools, if the teacher is not very, very careful to bring some kind of skill-based learning, if that is not very engaging, if that is little bit of taxing on the child, that may lead to physical aggressiveness in the future. Therefore, it is so important to understand the preschool curriculum, that instead of putting lot of writing, lot of reading, lot of academic oriented education system, if we can just try to make that more activity based and skill based activities in the school, then this struggling academically things will not happen. But the moment we understand the child is struggling, we have to be concerned about the physical aggressiveness of the child's behavior, which may happen in future. Third thing we have to be concerned is that child has difficulty in connecting friends. Being social is a natural phenomenon, and most of the child, they try to get a good connect with others, either by sharing their items, either by sharing some kind of similar thoughts, either by sharing some kind of objects they like. So such kind of things are stress busters, and these things make a child more social and more likable among peers. But when a child is unable to be a part of the peer group because of many reasons that we need to understand, if a child is not accepted in a group, or the child from her side or his side not able to get a good connect with others, in that situation, we parents and teachers need to be very, very careful in understanding that such kind of situation may lead to the physical aggressiveness of the child in the future. So if such kind of things are there, or a child is going through such kind of situation, we have to be very, very careful at that point of time, because if we miss that opportunity, then it will be very, very difficult for the child to get controlled from the physical aggressiveness. So this is the third thing we must keep it in mind, and we must be observant while we are just looking and taking care of our child. Then fourth thing we need to be concerned, when a child is getting disturbed or disrupted at home very often during any kind of activities, then that may lead to physical aggressiveness. For example, if the child is watching television and somebody is disrupting the child from that viewing of television, then the child's concentration gets disturbed and child also gets disturbed. So in this situation, being physical aggressive becomes very, very natural, and that becomes very habitual also. Similarly, if the child doesn't want to eat, but we want to disrupt that by forcing the child to eat, in that situation also, that becomes a kind of disruption into the particular thing. Same thing may happen during play, same thing may happen with sleep. So any kind of such situations, anything that child gets disrupted, that may lead to frustration, and frustration finally be converted to physical aggressiveness. And sometimes in this situation, we parents and teachers must keep it in mind. Those children who are not very vocal, it is very, very common for them to be physical aggressive because they are unable to say those things through language, through words. If a child will be able to speak out that, then the physical aggressiveness will come down. Therefore, if we can just understand that connect of speaking and becoming little bit of physical or expressing those things through physical behavior, both these things are well connected. So we need to understand that connection and work accordingly while we take care of our child's skill development process. So now, considering that, we have to understand few strategies that we must adopt to take care of child's physical aggressiveness. And what are those? Number one is that stay calm when the child is aggressive. So aggressiveness begets aggressiveness. So if the child is becoming little bit frustrated and aggressive, and in return, if the teachers and parents become aggressive, then the quantum of aggressiveness or the intensity of the aggressiveness in the child will increase rather than decline. So we must keep it in mind, whatever is the situation, if the child is aggressive, we have to maintain that calmness. So that shows that the child will observe and try to be calm. But most of the time, more than 95% of the situations, either parents or teachers, they also become quite aggressive, and that worsens the situation. So we must keep it in mind. If the child is aggressive, child doesn't understand, we understand, we have to maintain that calmness so that child observes and understands, and that will help for the child who are physical aggressive to make that. If you do not do anything, just leave the child alone, we also do not react to that situation, then definitely the chances of calm down of the child will be much higher than other way around. Then second is that don't give into tantrums. We know the physical aggressiveness is the outcome of the frustration, and frustration happens because of many reasons, and tantrum is one of them. If child understands he or she doesn't able to do a particular stuff, and tantrums are coming in related to those things, then it becomes very obvious that child will show some kind of physical aggressiveness. So whatever may be the situation, whether it's consciously or unconsciously, we must stop throwing tantrums to the children. Third thing what we need to do is that making the child more vocal. If the child is angry, if the child is frustrated, let the child talk about that. Let the child shout rather than being physical. So managing those things will be much easier rather than managing the physical aggressiveness. So that's what I was talking. If the child is more vocal, if we make the child to speak out various emotions, then it becomes much easier to manage those social negative behaviors rather than managing them other way out. So this is one thing we have to keep it in mind and make efforts to make our child to speak out rather than showing them physically. Finally, the last point we need to keep it in mind, introduce a reward program. The different children, they have got weakness to various things. Some children may be loving to have a couple of chocolates. Some children, they must be liking to have some teddy bear. Some children, they must be liking to spend time with some swing. So we must understand and we must keep a note of various things the child is happy to spend time. So at that point of time, we can introduce those reward points and reward programs. If the child will be remaining silent, then the child can be taken and provided with all those stuffs which the child likes the most. So in that situation, because the reward is much bigger, then those things, physical aggressiveness and other things, will be looking like much easy to manage, and child will try to come out of that situation because that reward sounds much better. So that way we can manage our children away, stay away from this physical aggressive behavior. So these are few things. So overall, it is easy. Only thing is that we have to take a note when the child can trigger this physical aggressiveness. So it's not a natural process. There are few things which triggers the child to be physical aggressive. So we must understand those trigger points and keep a note of that to all the people who are connected to the child. So that's all. It's a kind of very easy way to manage them. But what is more important is that it's good. You understanding and knowing everything is very easy. Most of the people, they are aware of. But as preschool management, what we need to do is that documenting everything. Because we know today the child is exhibiting some kind of behavior, but this behavior will be managed provided if we keep a note of all these things. Maybe if we are not able to mention in a week's time how many times the child has shown this kind of behavior, will not be able to manage them effectively because that behavior may be happening because of something else. So what we need to do, we have a template. Educated Kids is providing a proper template to get it documented. So we always suggest to have this evaluation at least once in 6 months. If once in 6 months is not happening, at least once in a year, we must have this assessment and we must have these things documented in the social progression of the child. So under this, what we need to do, either the child is in the preschool setup or the child is managing all the skills at home. These are the three things to be taken when we do this documentation. Number one, is the child, does the child kick other children often? The child has difficulty in studies, or does child push other children very often? If these are the three things, forget about others. If these are the three things, we have to track and evaluate it. For example, child never does it, we give a score of 0. If the child is rarely, meaning once, maybe in a week, that can be considered as rarely. Sometimes maybe 2 to 3 times in a week. If the child is doing that, we may be giving a score of 2 for that. If the child is doing that very often, maybe almost every day the child is doing that kind of behavior, what you can see in the left hand side, child kicks other children, child has difficulties in studies, or the child pushes other children very often, then in that case we'll be giving a score of 3. So we know that there is a scoring mechanism. We have already discussed in the beginning of this skill development procedures, and we'll just manage to do that at end of this particular segment. So anyway, that will be available to you in the detailed note of this management, and also there will be a template available to you in your the way you are getting connected to us, and will also help you to get this evaluation done for all the children in your preschools. So these are the scoring mechanism. Even if you are not having our own template, then these are the things you can just keep it in the diary of the child and make a note of these things, and see that if you are getting a score of 3, just communicate that to the parents, so parents can also take care of those things quite effectively. So that's all is we can do. If we do it very well, then at least we know that we have a documentation mechanism, and that will help us to manage the child in a most effective way. And that's all about managing the physical aggressiveness of the child. And we are closing that session, and our next session, which is the third component of the antisocial and aggressiveness, and that deals with when a child seeks revenge against others. So that is also a kind of skill that needs to be managed, and we'll just take care in our next session. So thank you so much for your kind attention, and I'm sure this session is going to help you in a most appropriate way when we are managing our children to have a better social skills. Thank you, and waiting to see you in the next session.